Hello, everyone. I hope you're all having a wonderful day. My name is Amani Elshaer, and I'm honored to be hosting this webinar today. I'd like to welcome you all yet to another exciting webinar under the Career Guidance Series, U.S. Residency. Alfaisal MedHub is an initiative under the umbrella of the International Office, College of Medicine, that aims to create an online global community for medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. Alfaisal MedHub's Career Guidance Series webinars have shed the light on various milestones of the application process of pursuing residency in the United States. Today's webinar is specially catered to the incoming residents. We hope to share beneficial knowledge and the do's and don'ts of making the best of your experience in shining as a first-year resident. Please allow me to introduce to you our very special speakers for today, Dr. Mohamad Alabdaljabar and Dr. Amani Elshaer, who would be delivering the webinar titled Guide to Making the Best of Your First Year of Residency. Dr. Mohamad and Dr. Amani are Alfaisal University alumni who successfully matched at Mayo Clinic's Internal Medicine Medical Residency program. As their first year of residency approaches completion, they will be providing valuable tips and insights to guide upcoming interns. Thank you for joining us today, Dr. Mohamad and Dr. Amani. We're looking forward for this exciting webinar. You're welcome to start when you're ready.
And as we're putting the slides, congratulations to everyone who matched from Alfaisal and from outside Alfaisal. I know sometimes we happen to have attendees from outside Alfaisal. So mashallah, you guys have done a great achievement. So try to celebrate, try to have fun, spend your time with your families and friends, as we'll be telling you in a second before you start your residency.
First of all, like Abdaljabar mentioned, congratulations to everyone who matched. And for those applying, best of luck. We're always here to answer all your questions. And this is like a brief overview. There's a lot of stuff to cover prior to residency, but that's just a quick overview of the must-know kind of pearls. So Abdaljabar and I will be sharing our experiences, but keep in mind there's always different experiences and viewpoints. So keep asking around and getting to know the system more and stuff like that. Mainly before residency, it kind of gets challenging because it depends on where you'll be, if you'll be moving to the US or you're already here and you're already familiar with the city that you're going to stay in. But prior to all residency, it's very important for you to know what's the area you're moving to, how's the safety in that area like. Finding a suitable apartment is important, whether you want to be living close to the hospital or not, and whether you want to be buying a car or not. All of those information, it's nice to be familiar with them prior to starting. For instance, I live several minutes away from the hospital, and it's really more convenient that way. I just wake up a couple of minutes prior to starting my rotation, and I end up being there on time. So that's something you could start be looking into more. And then I'm not sure if Abdaljabar has more aspects that he wants to cover prior to moving to the US. I know our experiences tend to be different.
Yeah, so during the talk will cover things before the US, and then we'll talk about things as you start your residency, and then just bigger picture of what things you should focus on your day-to-day, weekly basis, and so on and so forth. So each one of us, I mean, we live in different places, we have different circumstances. So before you travel to the US, one of the biggest things as you're moving to residency, whether you would need to get a visa or not. So that's something to keep in mind. And if you need to have a visa, you need to make sure, and I hope by this time, by May, everyone has a specific plan on how to proceed with getting the visa. And then once you move to a new city, you need to know where you will be living, what things you need to have ready for you, and then people of that city. If you know people in the same place, even in the same state, that can be extremely helpful to you, as you can start to ask them about just tips and tricks just on day-to-day life. Some people would tell you, for example, this city, even if you live really close, and I've been hearing this a lot, and I've heard this a lot about Rochester and Minnesota, they tell me even if your door or if your house is very close to the hospital, you still need to get a car because half of the year is too cold, half of the year it's snowy. And probably I got that aspect from their opinion, but then I was also asking other people who didn't have a car, and this gave me more information whether it's doable or it's not. And then when you start to think about these point of views, this will help you to choose the location. By choosing the location, as Amani was saying, how long would it take you to move from your house to the hospital? And that's very important. Anything that would help you to save time during your intern year and residency, for that matter, will be extremely helpful. I know in residency, you'll know, and I'm not saying this to frighten you or make you worry about things that you didn't start yet, but you will need every single moment. And if you can just cut off the time from your house to the hospital, that will be extremely beneficial. But then on the expense of being close to the hospital, you don't want to be paying a lot of your salary to the house. You don't want to be living in a place that's not safe. You don't want to be living in a place that all of the groceries and things that you like to go to are too far away because of time, and if you don't have a car, because of cost. So all of these are important things to start to focus on. And honestly, from my opinion or from my experience, I would say the best thing is to talk to people who live in the same place. If you don't know anyone, I would say I don't know a single residency program who will not try to connect you with your fellow interns and residents. So just try to shoot them an email, tell them, hey, I'm not from here. Or even if you're from the US, just ask them, what would be the things that I should keep in mind before moving to the US? Any neighborhoods that you guys would recommend? If you guys are married, then that is another thing to keep in mind. If you have kids, you will be asking about schools and so on and so forth. So all of these are really important questions that you should figure out, because the answer to these questions will give you more information about whether you would need to worry about groceries and how would you do that. And I'll tell you my experience about that. Whether you would need to worry about getting a car and what are available options you guys can do. And then if you want to live with someone who will be potential roommates that you can be with, and so on and so forth. And I hope by now that we have the answers to these questions. If not, that's totally fine. You can reach out to us to ask about specific experience of each one of us, Amani and I, or you can just try to ask your co-interns, residents, just shoot them an email, and people are really nice and everyone will really try to help you when it comes to that.
I completely agree. Those are very helpful tips. And then once you're stabilized and once you're here, the next step would be typically this happens between May and July. So sometime in June, you start to having more orientation. So all the residency programs, orientation typically happens around this time. So this time is where you'll get to know more about the hospital system, about how the program works. So they'll talk to you more about the details that we don't typically focus on, such as the insurance plans, how does the salary system work, if you need to be setting an account to receive your salaries, what benefits does the program kind of offers to you. So it's very important during this time, during the orientation, is to write down those points, to keep them in mind, just to make sure if there's any deadlines that you need to be meeting to apply for the insurance, whether you need to be setting an account and stuff like that. So that's where the orientation is helpful. You'll also get to know more about the program rules. So for instance, they might discuss about the leave request, when you're supposed to request a vacation, if there's a backup system or not. So all of these rules will be discussed during this time. And it's important for you to be attentive. It might seem like a very trivial thing, but it's always nice to know how the program functions so that you're able to request your vacations or leave requests ahead of time and being on to follow rules, basically. And then if there's any certain procedures that you're required to do throughout the year or certain requirements, that's something that's going to be discussed during the orientation. So it's a semi-formal kind of thing, but it does provide you with a lot of information prior to starting, the information that we don't typically focus on a lot during the application season and stuff like that. And then sometimes the program might give you some modules to solve prior to starting residency. So that's a quick overview of how the orientation works. And it, of course, it's different from each program to another program. Some program might make it in a prolonged period. Some program might just give it a day or two prior to starting your residency. So it really depends.
Yes, and a very important tip that helped me a lot with the beginning of the orientation, because to me, it felt like a roller coaster with the amount of information that we're getting. And it's not things that we, unfortunately, medical people like to memorize. It's things that we don't really focus on. So when I started, and again, it's hospital dependent, but when I started, for example, and I saw that there are different types of medical insurance, and it depends really on the hospital. I was like, should I get the really basic one? Should I get the middle tier one, or should I get the most beneficial, but at the same time, it's the most expensive one that has the probably the broadest coverage? So then you can ask definitely, and it's always important to ask people, but also at the same time, you know your medical needs. So if you always require continuous follow-ups, then that's a very important thing to keep in mind, because certain types will be more important to you and will help you save money. If you're married and you're planning to have a kids, and that's a new information to me that I got to know, certain types of insurance, they don't cover that. So it's an important thing to keep in mind, because you don't want to be having to pay. And here in the US, as you guys may know, it's really expensive to pay out of pocket for anything. Dental workup, vision checks, do you need glasses, contact lenses? All of these are important questions that no one will be able to answer in your behalf. So you need to figure out the answers to these questions before you pick up your insurance type. And this is just an example. The very important tip, I didn't say it yet, because orientation is full of many information. I used to make a lot of checklists. So things that I have to do or I can do before traveling to the US. Things that I have to do once I travel to the US. So for example, they require urine drug screening, blood testing, and for example, here at Mayo, they didn't accept anything that's done outside of Mayo. So they were like, once you come, we'll give you an appointment and you will go do the testing. And nobody will keep reminding you. And then anything that you tend to forget, this might postpone your beginning of the year or the orientation. And many hospitals will clearly tell you, if you are forgetting things and you're not fulfilling them, and you end up with the initiation date or the start date of yours is delayed because of things that you are forgetting, these weeks or this period will not be, you will not be compensated for. It's not the end of the world. And again, it's not to scare you about anything, but having checklists will help you a lot when it comes to just making sure that you have your documents and everything ready and you're not forgetting anything. That's one thing. So things that you have to complete. The other thing, and that's again why checklists are very important, and you might go through a lot of modules and orientations. Some programs will have certain trip policies. If you can travel for presentation, you'll have your own compensation for that, attendance trips, and so on and so forth. These are really perks, and nobody will keep reminding you about that. So if you know that you can apply for this number of conferences and then you'll be compensated for, then you're really helping your CV. You're getting the money back, you're traveling, and nobody will keep telling you, oh, did you apply? You didn't? Okay, please apply. Nobody will really ask. And if you know this information, you'll be able to get the advantage of all of these things that you will be told about at the beginning of the year. That is the second thing. And without checklists, it'll become really difficult. The third important tip that would help a lot, especially with deadlines, and I started to use that beginning of or end of last year, beginning of this year, is just to use your calendars. Just open them, put in an appointment, and just make sure that you have a reminder, because the iPhone, for some reason, I think it defaults to without alert, which doesn't make sense. I mean, what's the benefit of having the appointment without getting the alert that there's something that's happening today or tomorrow? But it's very important because it will keep reminding you about things that you have to try to submit, whether it's related to research, admin work, and so on and so forth. For example, today, I mean, I knew that we have the talk, but I always sometimes forget, what if I happen to have a very busy night yesterday? So I knew, and I was talking to Amani yesterday, but I was like, I'll put in a reminder at 11 a.m. just in case. I know that I have something important to do. I know what it is, but I always try to put in reminders, and that was extremely helpful to me. And it doesn't really take any time. You literally would open your calendar, you would add it, and you'd close. So 30 seconds.
Yes. I fully agree with that point. You'll have a lot of deadlines and a lot of things that you need to be following up on. So putting a reminders and organizing your calendar, whatever way you prefer, as long as you make sure that you have those all remembered. And then the last point we wanted to touch upon is the meetings and get-togethers. This is a time where you'll get to know your residency program. They might do some outings to get to know you more. They might want to take you out and stuff like that. So it's nice to, even though it might be intimidating and you're in a new environment and all of these people are new to you, it's nice to get yourself out of this comfort zone and build connections with those people. You'll be interacting with them for almost 3 years at minimum. So it's always nice to put an effort to get to know them, interact with them, build connections, because all of this will come in handy in case you needed anything in residency. If you had any questions, you'll always have people around you to reach out to, especially if you're in a program where you don't know anybody there. So take the time to get to meet those people.
Definitely. And two important things about this point. So residency, it's not easy. Again, alhamdulillah, I'm really happy about the place that I'm in and I'm really enjoying it for the most part, but you'll go through stressful things. And again, that's how residency is, whether you do it here in the US or any other part of the world. And if anything, probably here in the US, if you compare them to other parts of the world when it comes to wellness and making sure that residents are doing well and so on and so forth, they're doing better. I'm not saying that no one here is sad or no one here is going through a lot. You will go through a lot during residency, but it's fun. And to me, and I've always said this, and I'll always say that people are the most important thing in anything that you do, whether it's your residency, it's your wedding, it's your outing, whatever you do, having to go through something on your own or with people that you don't like is really tough. So the best part of the year or best part of residency to make connections, and connections, we always hear about connections and keep it in mind to match. Relationships, social connections is during beginning of residency in the orientation, because everyone is stress-free, and everyone is new to the program. So they're starting to form relationships and so on and so forth. So this would be the best time to just see who might be your people, because in orientation, you'll talk to different people. And again, you will not like everyone, and that's how life is. But you'll start to see what people are thinking about, what are their priorities, what type of people are they. And based on that, you'll start to have your own connections and social relationships. So this is one point. The other very important point, and this one starts on day one, if being a chief resident is something that you like or something that you target, then it really starts on day one, because they really care about your academic performance. But what they care about more is seeing you someone who likes to deal with people, because chief residency is a very nice year. It's something that it's an advantage, and it's a competitive thing in most of the programs. So it's not something easy that you can get to, but at least in Mayo, it's something that they would ask about each resident who you worked with. And that is the most important thing. So if it's something that you like, you need to be social. Again, I'm not telling you be that person, because some people don't want to do a chief residency year, and it's not a must. You can finish and go to fellowship or to practice. But if it's something that would fall under one of your goals to achieve during residency, then it starts on day one. And again, don't push yourself. Some people are introverted, and that's totally fine. It's not a disadvantage. But chief residents tend to be more social from what I saw. And again, that's not a rule. So it starts on day one, and it's something that you guys should keep in mind. And just a small point about the orientation and modules that I always try to tell people about. As Amani was saying at the beginning, you'll get a lot of information. So things about insurance, and there are different, we know about medical insurance, car insurance, but here, once you start, there's malpractice, if you lost your job, if you have a disability, but the important thing is you don't have all of the money, so it's difficult to start to subscribe to everything, every single thing. And the more important point is that not all of them are halal. So if it's something that you take into consideration as part of your important points, then read and ask about everything before you just go ahead and subscribe or go ahead and put some money in, because some of them are not. And here I don't know the exact information about every and each one of them, but always ask before you put your money in anything. And this, of course, goes to your bank accounts. Once you get your bank account, when you plan to lease, finance, or get a car, anything that you're planning to spend money on here in the US. And actually, even in our part of the world, unfortunately, you always have to ask and keep this in mind, because this is a very important point that many people are not really aware of. So they know that this is something I shouldn't do, but when it's being sold in a different way, they don't even think whether it's something we can or we cannot do. And again, it really depends on you.
I fully agree. All right. And that brings us to our next very common question. Am I supposed to be preparing anything prior to starting residency? I know it tends to be very overwhelming, and you want to make sure that you're doing well. I personally was asking this a lot. Am I supposed to be studying? Am I supposed to review all of my medical knowledge, or what am I supposed to be doing? So that's something that we want to make sure you understand, because it could be a point of anxiety in a lot of us. So the main thing I would focus on during this period is focus on settling in, focus on finding an accommodation that you're comfortable with, focus on getting to know your co-residents, getting to know your program. I want you to kind of refuel prior to starting residency. You'll be working really hard for at least 3 years, if not more, on a day-to-day basis. So take this time to actually refuel yourself. Think positively, think of your future goals. Don't worry about studying at all. What you need to understand is that our medical knowledge is strong, despite us sometimes feeling that we forgot and we haven't studied for a while, and intern year kind of did not put us into that studying mindset. But keep reminding yourself that we were able to pass step 1 and step 2, and we're here now. We passed the medical school phase. So medical knowledge is there, even though you feel like it's not. This is a very important point. And with residency, it's mainly about how to deal with people, how you're supposed to approach the patient, how to communicate with the patient, how to take certain physicals and labs and make a plan out of it, how to deal with other staff, how to work with your attendings and your seniors and so on. And that's not something I could tell you to read about or prepare for. That's basically an experience. You just have to experience it yourself. The only thing that I might be recommending prior to starting is getting USMLE Step 3 out of the way. Typically, with USMLE Step 3, it's a requirement for each residency program to be fulfilled within the first year of residency. Sometimes it might go up to the second year of residency, but it needs to be fulfilled prior to your graduation. So given that the residency is more on the hectic kind of schedule, you might not find the time to actually go back and dedicate time for UWorld and make sure that you get a decent score. It can get overwhelming. So finishing it early will give you this boost, and you'd feel like there's less stuff to worry about prior to starting residency. So that's something that I might recommend. But again, if you're not able to, or if there's other things going on and you're preparing for the traveling and the accommodation, that's fine. I've seen a lot of residents doing it. All of my co-residents actually did it throughout this year, so it is doable. But if you did have the opportunity to finish it before, that's something I would recommend.
So yes, before residency, you guys don't have to prepare for anything. And this is the point that everyone would say, and we totally agree with that. The more important point is you don't have to stress about not preparing about anything. People know that they shouldn't start preparing before residency, because that's been said, and every single resident that you'll ask, they will tell you go and have fun. But then from inner inside, sometimes you can start to stress about things, and especially that sometimes we think about certain programs, more AMGs than IMGs. AMGs, they graduate and start residency sooner than we do. So what if, and what I would say, take this completely out of your way of thinking, because once you start residency, it's going to be tough. And again, I'm not saying this to scare you, tough, but enjoyable. And you will start to really appreciate, probably, I wouldn't say day by day, but week by week, the amount of improvement that you're noticing on yourself. And especially it's more with the clinical skills and just being part of the system rather than your medical knowledge. As an intern, probably first couple of months, you'll be learning medicine and hopefully you'll be enjoying that, but it's more about being part of the system and knowing how to navigate the system. And this is something that you'll not be able to really be able to master or at least start to learn before you are in the system. So I'm saying this just to reassure you and to tell you to stop worrying about anything before starting residency. Take the time to save your time once you start residency. And what do I mean by this? Just try to study, I mean, not study as in study, but just try to make sure that where you're going to live is a place that you will be hopefully feeling comfortable in. You don't have anything that would minimize the time that you spend once you arrive to the US, go ahead and do it. So I'll give you some examples. Before I traveled to the US, probably 1 to 2 weeks before that, and these are, to me, very important tips, and I always tell them to my friends who ask me about things that they need to do before coming. So now I started to think about things that I would need once I hit the airport. I would need a SIM card. So now most of the phones you can download an eSIM and you can start using the card without arriving to before arriving to the US. So you don't have to worry about reading about plans, getting a number, and so on and so forth once you arrive. So this is what I did. I had my Saudi line, and then on the other one, I literally went over certain plans. The one that I liked, I got it as an eSIM. It didn't work outside of the US, but the moment I arrived, I had my line ready. That's one point. The other point, thinking about where you'll be living and what things you would need. So for me, I knew that I wouldn't get a car once I arrive to the US. So I wanted to be in a place that is close to the hospital. So I got that. And then I was thinking about the groceries. I didn't have a close market that I can go to. So one of the, and I'm not advertising for any company, but I think you guys know Walmart. So they have, to me, the Walmart Plus was extremely helpful because once you subscribe, they deliver to your house anytime, any day, as much as you want, and free of charge. So it's something that I subscribe to. And until today, I mean, now I have more time and I can go but groceries is not something that I would worry about just because you can do everything on your phone and then you order them to your door. And again, I'm not advertising, but this to me saved a lot of time, not only when I arrived to the US, but throughout the year. Other things to keep in mind that can make things easier for you. So I started to read about the place I'm renting. They would need, for example, electricity and gas to be paid by myself, and I have to have an account. If I can do that online, I did these in Saudi Arabia before coming to the US. If I want to open a bank account, what type of bank account do I want to open? Which bank and what documents do they need? So as soon as I arrive, I can go and finish things. And the good thing is most of us would try to arrive in the orientation week or slightly before that. So you would need during this time to enjoy your time, to get to know the city, get to know the people, and get to finish things that are important to you. So bank account, signing contracts, and so on and so forth. So everything that you do from that standpoint will save a lot of time and will make it a way less stressful experience once you come to the US to start your residency. I totally agree with you, cannot study on how to be a physician. And again, we're here to reassure you, you reach to a stage that your medical knowledge is enough to start residency. And we always say, and we always put in our social media profiles that we are lifelong learners. That's the truth. Even once you're a consultant, you'll continue to learn, because at the end of the day, each time you're learning something new, it means that you might not be practicing something else that you knew before. So you'll tend to forget. Many things are being developed day by day. So things that you'll not know about, even as a consultant, is totally expected. So don't be too harsh on yourself once you start residency, because that's how we are as physicians and as human beings. And for step 3, agree with that. If you can do it, go ahead and do it. If not, and always take other things in mind. If you think you can finish studying for it, and now we're in May, so I don't think you guys will face an issue. But for people who happen to see maybe this video later on, if you are thinking about step 3 in advance and you can do it, that would be very helpful. But always keep in mind the cost of travel as well, because if that is something that you would worry about, then just postpone it. You don't want to travel, let's say, from Riyadh to the US to do step 3 and come back and then travel for residency, because the cost of travel, unless you want to do this for visa purposes, you're planning to apply for H-1B, or you don't have a financial issue. But otherwise, cost is an important thing, because if you're just putting one full trip to go to do your step 3 and come back, then it's something to factor in before you take this decision.
Exactly. All right. And that brings us to our next point, which is the dreaded first day of intern year. So now what's very important in this perspective, at least for me, is to normalize feeling overwhelmed. It's very important to be aware that you are in a new environment, you are in a new system, you're in a new city, you're training with different people. So it's very important to try to minimize the negative self-talk during this time. It's okay for you to be completely clueless. It's okay for you to feel lost. Always remind yourself that the program ended up choosing you after interviewing hundreds and hundreds of other applicants. So you are well deserving of being there. And it's normal for you to feel lost. Sometimes it might go up to 6 months or the entire year. Some residents told me that they felt lost the entire first year. So that's completely normal to feel. And normalizing that feeling at the beginning will make you feel less overwhelmed. Which brings me to the next point, which is patience. It's very important to be patient throughout this process. Now, the thing that will make you more competent and you'll feel more confident in yourself is basically the experience. And I cannot come and speed up experience for you. It has to be several days and weeks and months of training. Then you'll feel that you're more comfortable with dealing with stuff. So that's why patience is very, very important. And I was actually at fault at this because I used to feel like every time the third year residents comes and corrects me, I feel very competent. And why did I not recognize this? And why did I not do this? But when I think about it, the third year has been doing this for 3 times the amount of time I was doing it. So you need to understand that everything actually comes with time. And the last point is very crucial, and it's actually something that really helped me a lot, is asking questions. Now, there's a hierarchy for a reason. We are interns, and then there's the senior residents, and sometimes there's a fellow, and then there's an attending. All of these people act as barriers to your mistakes, and all of them will help you throughout the process. Use the fact that you're still starting and ask as many questions as you want. I used to ask questions about the tiniest details, about how to answer a page, about how to approach the patient. So this is really an opportunity for you to use this opportunity basically to ask as much questions as you like. Do not ever think that you're a burden. Actually, I feel like people who don't ask are doing something disastrous, because why are they not asking questions? And are they messing up something? So always feel free to ask those questions and use the opportunity to learn things earlier on.
Yep. And I think you guys have noticed we're doing the same thing. So Amani is going and then I'm going over the same points, but we are trying to give you different perspective and experiences about single thing that we thought is important to cover. So day one is going to be tough. And again, you've noticed that I'm saying this again and again, that I'm not here to scare you. And it's not, but always having realistic expectations, not only with residency, with anything in life, would make it way easier once you start and see, yeah, I knew that it's not going to be easy, but people were telling me that it's going to get better. And I promise you, inshallah, it'll keep getting better and better. This doesn't mean that you'll be in like a happy life with no stresses whatsoever, but things will start to improve and you'll start to appreciate this. On day one of residency, and depends on what rotation you guys will start with, most of the time you will feel that you're new to the system and now people are looking for answers from you. So our nursing amazing staff will be paging you and asking you questions. Sometimes you know the question, or you know the answer to the question, but you'll be wondering, I mean, should I go ahead and answer? Is it okay to give this medication? I mean, Tylenol is Tylenol. You will not kill someone from Tylenol if you don't use, of course, a big dose. But so a pill of Tylenol, you'll be able to prescribe because the hospital, everyone else trusted you to give you the license to be able to prescribe. But sometimes you think twice. And again, it's totally normal to ask. Ask about Tylenol the first day. So hopefully by the end of the month or the end of the year, you're prescribing appropriately antibiotics, other more important medications, without really needing to go back and ask if you know what you're prescribing, of course. So on day one, for example, I still remember this, and it's a funny story. I had the service pager because each day one of the residents would carry the service pager. So one of the nurses paged me and asked me, the patient glucose was 70 or 79. Should I give insulin? And I mean, the answer to this question, usually the normal range in the hospital, you need to keep patients' glucose for reference 140 to 180. It's like, obviously no, but why are they paging me? I felt that this question is too straightforward to be asked on a page, but I still didn't give an answer before I asked my senior resident. And it's funny, just because it was day one, and I thought that this question was too straightforward to be asked. So I thought maybe I'm missing something. I really don't know. So, and we all laughed. And now it's a story that I keep bringing forward to anyone who asks me what would be day one expectations. Because sometimes, and again, it was not a test, but since there was an order, they would not skip a medication before asking the treating team. This is an information probably I wasn't really fully aware of. And that's why I thought this question was a little bit odd. Why they're asking me, it's obvious not to give the insulin, but they cannot skip it before asking a treating physician. And likewise, when you start to talk to families, when you try to, the things that we learn through angry patients, patients who are, all of the different scenarios that we used to study and have fun learning with our group of friends, angry patients and things like that, they will be happening in real life. You will be alone. I mean, alone, you'll have your senior team, but it's not like anymore a situation that you know that is not happening in reality, and you have to deal with that. You always have a lot of support in your residency program, so always try to make good use of that. And again, it's totally normal to worry. On day one, some people, and that's totally fine, and now they're really rock stars. Some people cried on day one. Things that I've and now it's really funny stories whenever we happen to sit together and remember things that we went through. And it's fine if you feel that you're stressed, reach out to your family, reach out to your chief residents, reach out to your friends. If you feel that this is the only way that you would go ahead and just try to relieve your stress or try to maybe help with coping with stress on day one, that's fine. I know that day, my co-intern who happened to cry, I didn't know about that. But when she came and I saw her, and she wasn't really afraid or embarrassed about that. And it's something now, whenever we remember, we say that, I mean, day one was tough, but now we're sure, alhamdulillah, that we were doing better. It's us feeling more comfortable with different things that we're doing. And it's people giving us feedback day by day that you guys are doing better. Things that we used not to know how to deal with, now we're doing them, alhamdulillah, without really a second thought. And all of these things are really assuring. And all of these things are what we were really working for in medical school, just to try to be able to help people be more efficient, depend on ourselves. All of these things would start to happen day by day. And this, again, is related to the point of patience. When it comes to questions, always try to use your support network, use your seniors, co-interns. And this habit is very important because we think, or at least that's something we always notice in real life, whether it's in medicine or outside medicine, we tend to ask people who are above us, or we think who are above us, but that's not the right way to do it. Anyone who you think, even if it's your kid, your little brother, or anyone who you think who might be able to teach you something, ask them. And don't feel that, should I am the treating physician, I am the resident, should I go ahead and ask the nurse to teach me? No, I will just read about it, or I'll ask my senior resident. And that's a totally fault or incorrect type of mentality to have, just because when we say that we are the medical team, we are a team. And you being the physician lead or help leading the team, this doesn't mean that you know more than they do. You might know in certain aspects more than they do, but when it comes to many other information, always try to ask questions. And this is not only about your learning process, but even part of your rounding that we'll be talking about. Reach out to nurses and see what they think. I always try to ask nurses what, I mean, that's you guys should be doing the same thing once you start about overnight events, any concerns, but even the slightest things, when we happen as a medical team to discuss and agree to remove the Foley catheter of patient X, I wouldn't go ahead and just put the order. I always try to reach out to them, because at the end of the day, once we remove the Foley catheter, it's the nurse who will be taking the patient to the bathroom, or if they have incontinence, will be cleaning them. What if they have other concerns that we're really not aware of? So I always try to ask them, we're planning, and especially things that would need really heavy nursing staff to do. I wouldn't ask them about a medication if we think that a medical team is necessary for the patient, because that's not their scope of or field of expertise, but I will put the order, discuss with them why we think this medication is important. But Foley catheter, for example, it's something that they will have more information about the technicalities once it's removed, more than we do as a medical team, who we see the patient and then discuss and put in the orders ourselves. So that is, again, a very important thing to keep in mind when it comes to asking questions. And then as you progress in your training, sometimes you'll find that your way of thinking, I mean, people, your seniors, your friends, no one is perfect. So sometimes you will disagree, or you might not be on the same page with your senior or with your co-intern resident about, let's say, for example, a diuretic plan. You think that the patient needs more diuresis. So when you ask them about a question and they give you an answer that you don't think is the right thing, of course, it's if there is potential harm to the patient, don't do it and try to discuss more and know the answer. But if, for example, it wouldn't make a big difference between 60 Lasix or 80 furosemide, these are the same medications. So you can definitely try to understand why do they think this is what is needed. And if you are not convinced, you can tell them politely, just in a polite way, you can reach out for more resources. So your pharmacist, your consultant, in a discussion fashion. You're not really overstepping them and you're telling them clearly, no, I think you're wrong, I'm asking the consultant, because obviously this is the wrong way of doing it. But if you just want to see what would be the best for the patient's care, then it's always a good opportunity for you to ask, make a discussion, learn from the discussion yourself, and more importantly, just try to do whatever is best for the patient.
I agree. All right, so that brings us to our next point, which is our expectations as interns. Now, I feel like this is a common thing across all the US. In June, everyone knows that everyone's starting in July. So everyone is aware that this is the time where all the new interns start, some mistakes will be made. Everyone is basically expecting nothing of you. So in terms of being efficient, in terms of patient management, they have very minimal expectations. And that's kind of helpful to know ahead of time, because it's good to know that no one expects anything of you. And all you have to do is basically these 3 points I have in the slides, which is being reliable, meaning that never lie. If someone's asking you something about your patient and then you're not unaware or you did not have that checked, just be honest and say, I don't know, I did not check that, I'll look into it. And that makes you more reliable, because whatever information you're sharing is always the correct information. And always try to, if you're given a certain task, try to fulfill that task in a timely manner. So if your attending wanted you to start a new medication, or if your senior residents asked you to discharge a patient, having those tasks done in a timely fashion will make you more reliable as an intern. And basically just be a normal person with a great attitude. Now, attitude will bring you a long way. It is a stressful, it could be stressful, it depends on how you see it, but it could be a stressful time period, especially if you're doing an inpatient service. So you're seeing those patients and you're starting to do rounds and you're putting the orders in. So being optimistic and actually having a good attitude will make the workflow way nicer and way more enjoyable for the entire team. Like, I personally experienced 2 different types of teams. I had a senior where she was complaining all the time and the co-intern was not really that helpful. And it felt like the entire month is lasting ages and everything was kind of becoming messed up. And then I had another busy service where everyone was actually willing to learn. Everyone was having a positive outlook about stuff. We get like certain admissions and no one really complains. And everyone enjoyed working with us as a team. All the attendings mentioned great things about us and they fulfilled like amazing evaluations. So attitude is something I would really work on throughout intern year. And of course, being eager to learn, showing your enthusiasm. If there's something you're not aware of or unsure of why this is the case, or why we're starting this medication, or why we're doing this certain order, always ask questions, because this will give you an idea about their thought process. And then next time you're faced with a similar scenario, you will do that and implement that thought process yourself. Start to read a point or so about your patients, and then presenting it or talking about it, discussing it during rounds. This is all kind of habits that will show how you're willing to learn and how you're eager to actually grow. And like Abdaljabar mentioned, we're always in a learning process. So even as attendings, sometimes attendings come and ask me a certain question about how a system is run. So we're always learning, and it's a very nice habit to have.
Definitely. And the probably the summary of this slide is be, a nice person in all of your different characters that you could show. And it's something that we would always keep in mind and would try to aspire to achieve, whether it's in residency, in medicine, outside of medicine. And it's something that our religion asked us to, and it's something that we would uh, be punished upon if we don't do it this way. So be reliable, be honest. If something you didn't see, you didn't do, say, I didn't do it. If a patient that you were too busy this morning to see and you had many other patients, it's fine. Tell them that I chart reviewed this patient, but because of so and so, I couldn't see the last one. And usually you try to prioritize more urgent or more sick patients. Sometimes you might have patients who might need translators and so on and so forth. So things can take time in the hospital, and people will expect and will understand when it comes to this. And sometimes you might be working with a team, as Amani has said, whether they keep complaining or they don't understand, or a consultant who, for example, would make you feel that you didn't do enough, although you were literally trying your best. And this is again how life is. You'll not be always, all of the time, working with amazing consultants. Some consultants might take, again, not you'll not work with every single month and every single week with consultants that you like. And sometimes it's not because they're doing wrong things. I'll give you an example. In one of the rotations, we worked with a consultant and she was amazing. I would literally trust her with my health, with my family's health if they were in the hospital. But one thing that we didn't really get along too much on, or not only me, also the team as well, we used to spend a lot of time in each hospital's, in each patient's room. So it's nice for the patient, and I totally understand that. But when you start rounding, for example, at 8 and you finish at 1, that is stressful to the team. So she's a very nice person. She's very knowledgeable. But then because of this thing, our team didn't like what was happening on day 1 and day 2. So we politely approached our senior resident and she was able to talk to her. And then the next day, things were way more efficient. This is an example of the fact that you'll not like every and each consultant, even if they have really very nice character and they're doing everything to support you. And then the other example is to show how you can sometimes solve conflicts, because you don't have to keep going through this on daily basis, finish tasks late and finish and leave the hospital late and just try to cope with the stress. Coping with stress is nice, but part of it is try to looking for solutions. So again, just try to be a good person. Don't lie, be reliable, be nice to others. Sometimes when it comes to patients load being low, and you guys, one of you or two of you are allowed to go home early on, always, it's always nice to go home early on, but always think about your co-intern. And that's why, our Rasul sallallahu alaihi wasallam, أن تحب لأخيك ما تحب لنفسك, always try to put yourself in others' shoe or in others people's shoe, and try to imagine, it's nice for me to go home, but wait a minute, yesterday it was my day off and they've been working for 3 days. So maybe this day I'll stay and they'll go home. People will appreciate this, even if your co-intern, and alhamdulillah, I haven't seen this, even if your co-intern is not appreciative of this, you know that you're doing this because of who you are. You're not doing this to expect something in return, but you're doing this because of who you are. But people will notice this, and you'll get your next day, for example, you'll get to go home early. Your senior will see this, and even if the next day the same co-intern wanted to go home early, they will tell them, no, you went yesterday. So good things will happen. You don't have to worry about things that would come in return. You just need to worry about yourself and being the best person you are. It's not easy. After working 10, 11 hours, you'll be tired and you want to go home. And sometimes you will find that I work more than my co-intern because I have more patients, so it's my right to go home. Don't think about it this way. Just be a nice person, and it's not easy. I'm saying this, I'm not that person all of the time. Sometimes you feel that, and then when it comes to going home early, and if the senior resident will tell you, you go home early, you will not tell them, no, let my co, because sometimes you will feel that you might need to go home early just because you worked a lot, you're tired, and they're telling you and they're offering you to go home early. It's fine. But it's always nice to think twice before taking what's good and leaving what's bad for your co-interns. And it's always a very nice thing to try to put them or help them when it comes to things that they're going through, whether by going home early, leaving for a hospital appointment and try to cover for them. And again, everything is ruled by the hospital and residency policy. So no one would tell you that next day I'm taking it off, can you cover for me? The hospital will not allow this, just to give you some realistic expectations. But sometimes it's just about 1 hour, and this 1 hour might show how generous and how a good person you are. If that's the case, try to do it because of who you are and because good things will start to happen on what you do. Keep smiling if you can. Some days, I mean, I start my day, I can't smile. I mean, usually when I come to the hospital, probably first hour, I'm nice to everyone, but of course, I'm not smiling. I mean, I can't smile, don't get me wrong, but it's not like 6 a.m. with no sun and I'm coming to the hospital very happy. People, I mean, I would greet people, but then probably my first hour is just try to focus, get things ready. And then throughout the day, I would become really more smiley person, I would say. But anything that you can change yourself just to be a better person inside of the hospital as well as outside of the hospital, try to do it. And part of that, being nice to your neighbors. And we all know these things, but when it comes to residency, I think, alhamdulillah, we don't get to stay late at night as residents. So less likely to be causing noisy things at your home during residency. But even if you're vacuuming your house, you're cleaning the trash, you're doing whatever you're doing to help just the building, and do them and keep in mind when you're doing them. When I vacuum the house, even if I'm doing night shifts and I'm coming back to home late, I would say then I will wait, do it the next day, just because I know that I have neighbors and it's not nice to vacuum the house late at night because it's not nice.
Well, it's really hard to imagine you not smiling, Mohamad.
Inshallah, probably first hour, just because sometimes some teams talk a lot. And the first hour for me, I like to chat review, just to finish the first hour with my chat reviewing and try to minimize any side talks. Because some teams, mashallah, they're very nice. They talk a lot. And in the first hour, we don't have time to ask about coffee. And if you like coffee, get yourself a coffee. If you don't, let us focus and then belish.
I agree. All right. So now we'll quickly be discussing the schedule. So I apologize if there's any other specialties. We'll mainly focus on the internal medicine kind of scheduling outflow because I'm not that familiar with the other surgical or other subspecialties. But mainly for us, we do have what we call an inpatient service and an outpatient service. It took me ages to understand what's the difference. And until I started residency, I finally understood what's the difference between the two. And basically, inpatient service is being in the hospital, seeing patients starting at 6, seeing patients all the way throughout the day, doing rounds with the team and stuff like that. And outpatient is basically going to clinics, seeing your patients. And it's different from one program to another program. Some programs, what they do is, for instance, at my program, we do 4 weeks of inpatient followed by 4 weeks of outpatient. So I have a month of extensive work and then a month where I have every weekend off and the work is lighter. Some programs like to incorporate the outpatient or the clinic days in the inpatient service. So every Tuesday, for instance, they go to the clinic days. So it really depends on your program. So it's something nice to familiarize yourself of how your program is structured. The other point is the vacation time. So throughout the year, the uniform vacation time is 3 to 4 weeks for all the programs. And the way to request a vacation, it depends on your program. For instance, my program asks me to request a vacation 3 months in advance. So I do have to actually keep that in mind because anything less than 3 months in advance might be rejected. So I will make my plans ahead of time. Some programs are more flexible. Some programs will actually give you a certain vacation time. You don't get to choose your vacation time. So that's something to be aware of. And then the last thing is the backup system. Basically, if a resident was sick or did not show up to work and it's a busy service, they need someone to replace this resident for this day. So sometimes we do cover, it depends on the program and the number of residents in that program. You can end up doing 4 weeks of backup throughout the year or 2 weeks or 1 week. It depends on the number of residents available. But basically, if you are placed on backup, you cannot request a vacation during that time. You're supposed to stay in the same city in case you were called. So that's all important information to be aware of because, for instance, I wanted a vacation at a certain time, but I was a backup during that time. I ended up having to schedule with another co-resident so that I'm able to take the vacation time. So it's good to be aware of those things that we're not really familiar with prior to starting residency.
Yes. So, and again, these are important details to just have a broad idea or understanding of. But once you start your residency, you will feel probably in the first couple of days that you're not totally understanding everything that's happening. But day by day, you'll start to get things more and more, and it'll become really a piece of cake for you on what do we mean by this month? What is this rotation is going to take place, and what's the duration of this? What are the rules of that? So it'll become very easy once you start, and you don't have to worry about them. And even I know that each residency program of yours are sending you a lot of PDFs with rules, and just try not to miss deadlines, and then everything else, inshallah, will fall into place. The very important thing to keep in mind when it comes to vacations, all programs will ask you to put in your vacations from before a good period of time. In Mayo, it's 3 months. But other programs will have their own because they need to understand when you're traveling and when you will be off, whether they would need to put in backup for you and so on and so forth. Most of the programs, they will not allow you to take vacations in the inpatient months because inpatient months are probably one of the busy months. And you need to be, and it's more the better learning opportunity for you. So it'll be for your outpatient months. So that's why it's very important, and especially if you have certain things that you need to attend, whether they're weddings, the things with your family, planned vacations. These are very important things to make sure that you are scheduling beforehand. So when it comes to you traveling, nobody would tell you, no, you didn't tell us, and so on and so forth. The details of your schedule are not really things to worry about because, mashallah, you already matched. If you're already matched, khalas, you either will stick to the traditional versus X+Y, where you have inpatient and outpatient rotations. If you are going to see this video after it's recorded and you're planning to apply to residency, then it's something to keep in mind, which programs have which schedule. Personally, and I think most people agree that X+Y for internal medicine is easier. It's more convenient where you have your inpatient months and then outside of them you have your outpatient months. The other traditional one is just to have inpatient months throughout the year with 1 or 2 days of clinic during each week, which to me, I mean, I haven't experienced the other one obviously, but this one I like it better, and most people, and that's why more residency programs are trying to change to the X+Y one. Again, you don't have to worry about the details. If you've already matched, you will get to know it day by day. And for the backup system, you'll know the rules for that. Today, and I'm backup. So I'm here in my home, but I have my pager next to me just in case. Inshallah, nothing would happen. But I mean, if there's any emergency, someone is calling sick, then you have to go cover for them. Usually backup days are nice because it's you days off, but you can't really travel or go anywhere just because if there's anything, you need to go to the hospital.
Exactly. All right. So given that the inpatient service is the more demanding service, we'll quickly walk on how to approach this kind of rotation, especially if that's something you're starting with. But keep in mind, we won't really dwell on the details because this talk is mainly prior to residency, but that's something that might be helpful if you're starting with an inpatient service. So now, the main thing on how to approach it, and especially if you're starting with it, is understanding the system. Now, by understanding the system, what I basically mean is, at what time am I supposed to show up? How long is my shift? Some shifts last they have a long call where they stay till 7, some of them stay till 5. So how is the shift like? How many patients am I going to be responsible for? Is there a limit to the number of patients I'll be seeing? Will we be seeing new admissions every day? So all of these important information will help you and have an idea about how your day structure is going to be like. And of course, it's very important for you to familiarize yourself with the EMR system the hospital use. Like for instance, at our hospital, we use Epic, and a lot of the hospital systems also implement Epic, but sometimes there's another EMR system. So, and we don't really have much exposure to navigating through those systems. So it's good to actually see, and sometimes they give you orientation on how to approach it, but you could also seek guidance from your seniors, asking them on how to best approach this kind of how to navigate through it. Like I remember my senior resident sat with me and he helped me put all the tabs that I'm supposed to be having, and he told me the function of each tab. So that gave me a lot of idea prior to starting. Do not worry about being efficient and being very fast at doing this. just focus on learning the process. And like we discussed earlier, the expectations for you is very minimal. It's very expected that you will be slow, you will miss stuff, you will be asking a lot of questions. So having that in the back of the mind will make you less anxious. And again, learning it early on will make it much more easier for you later on to focus on other stuff.
Yes. So as Amani said, probably nothing to say in a different way. You'll worry about things. Things will be a little bit more challenging as you start, but it's always about understanding where you're in, your rotation, time to start, time to finish the day, and then understanding or having your own system. And again, nothing to do now. Just try to, once you start your system, try to have your note templates, structures. These are, you might not know what we're really exactly referring to or talking about, but once you start and you have these things, you'll be very efficient. And again, I noticed that I've said the word again a lot of time doing this talk, but during the year, you will remember that how you started and how you felt, or at least how I felt, that my AMG amazing colleagues, they were way more efficient than I was, just because they went through the system. This is what they practice like. Most of them, they're familiar to the EHR. They're using Epic in many places, or at least here at Mayo. So I was not really familiar when it comes to obtaining information and then to synthesizing data and then writing my own notes. My notes, I used to trying to finish my 6 notes, 7 notes by 3, 4 p.m. And the consultants were very nice. They didn't have note expectation on when to finish, but they were very understanding in July. Now, alhamdulillah, and just subhanAllah, I know how things would go. Now, most of the time, I try to finish all of my notes before noon so I can go to the noon conference and just try to focus on my noon conference without having to worry about my notes not being done. So just see the big transition of 4-hour difference, or working about notes, stressing about notes, making sure that I'm doing more and more, not more and more as an effort, more and more putting time to finish the notes, and how as the year went by, things are becoming better. Things to keep in mind in your intern year. Remember, you are a medical student. You will be many times working with medical students. Be nice to them. We as human beings tend to forget what we went through, whether when we were having less money to more money, less health to more health, medical student to resident. So by saying be nice to them, if they are planning, or they always help them shine. So if they want to get more letters, help them preparing there for presentation, for the management, getting more information. If they're learning, or they're trying to learn more about certain things that you can teach them and you have the time. I know you'll be busy. If you don't have the time, tell them. During the morning, this is what I tell medical students who I happen to work with. Most of the time, before rounds, it's very difficult for me to discuss and talk to them. We can go over their plan and I can give them what my thought process is, but it's difficult to teach before rounds. But during the rest of the day, you will have time. So if you like to teach and if you have time, do it. If not, sometimes people don't like to teach. That's totally fine. You can show them where the cafeteria is. You can send them home early, or ask the senior resident to send them home early once you guys are done. Again, always try to optimize their learning opportunity, because they're not here to suffer. And some people who keep medical students to 6 and they're doing literally nothing, this doesn't make sense. Don't try to answer all of the questions as an intern because and you're trying to. It's nice to show that you know your patients, you have information. But remember, many medical students, especially who are in their last year, they're trying to get good letters. So if the questions that are being asked, you are answering them, or you are planning to do A, B, and C for your patient who the medical student is following, and you're not telling them about the plan, to me, this is not nice. Because tell them, share with them your plan and let them shine. Because people would understand that you are helping them, and consultants, senior residents will appreciate this better. But you're not doing this to gain your consultants or senior resident appreciation. You're doing this to help your medical students. So it's something to keep an eye on if you have medical students in service. And I'm saying this in the inpatient service slide just because in the outpatient, most likely you'll not have medical students. So it's more with the inpatient services. Otherwise, always remember, try to have your own system. People will have different systems. And I'm very grateful to the senior resident who I worked with in my first month, because she was amazing with teaching us the same thing that Amani has mentioned. She met with us the day before the beginning of our residency if we wanted to meet, and we all wanted to meet with her. And during that month, I was always hesitant to say my plan just because I always thought maybe I'm missing something. I mean, I knew I wanted to do this, and that for the patient, but what if a different diuretic would help them more? And she was always would stop and ask me, what do you want to do? And she would put in the order. The only time that she would offer to discuss if I'm ordering something wrong or if I'm ordering something invasive or really costly or expensive with no added benefit. But otherwise, when I had this mentality starting my first month, subsequent months, I worked with other senior residents who are all great, but some of them are more micromanagers. They tend to go in details about everything and just changing things, even if there's no difference. So when I had the experience of knowing that as an intern, I can do orders, not do orders, as an intern, I can have my own plans and defend them if these make sense. The rest of the year was way more beneficial and enjoyable to me rather than just trying to listen to someone else's opinion, especially if it's very similar, like the type of diuretic. If there is no added advantage whatsoever, then stick with it because it's he or she, they're your patient.
Yes. All right. And so that brings us to the next point, which is pre-rounding. And like Hamad mentioned, this is the kind of the most stressful part of the day. It's you need to quickly review all your patients, prepare them prior to starting your rounds. So it tends to be more stressful. So the way to approach this is by developing a systematic approach to all of your patients. So if you are responsible for 6 patients, always have this outlook that I need to be doing those set of things for each patient. And for instance, I wrote my workflow is that I typically look at updates from overnight. I look at the vital signs, the labs, the imaging, and the medications that were administered. And while going through those stuff, if, for instance, I saw something I did not know about, for instance, let's talk about hyponatremia, and I'm not sure how to approach this, I just write a small point for myself, just in case I had time to read about it prior to round starts. And then I go see my patients, and like Abdaljabar mentioned, this is the time where you get to talk to the nurses, look at and see if there's any overnight events that you missed that's not in the chart, talk to the patients, do your physical. And then once you're done with all of this and you still have time prior to rounds, you could discuss the plan with your senior and have their insight. And you could read about that one point that you put for yourself that you're unsure how to approach. And if you do this systematically on a day-to-day basis, at the end of the month, you'd learn 30 new things. You'd know how your senior works. You know how you'll become more efficient at approaching those things. And it would be helpful to arrive early if you felt that that's necessary and if you're unfamiliar with how the system works. I used to go within the first month, I used to go 20 minutes earlier than usual, mainly to get more familiar with how everything works. And of course, like Mohamad mentioned earlier, putting a checklist for yourself, make sure that you're organized, have a workflow. Like I used to put points. I need to finish pre-charting. I need to finish putting the orders and stuff like that. And I just check them off throughout the day because things could get hectic and you can get orders from different seniors and attendings and so on. So always develop an organized, clean system for yourself.
Yes, just to add a small point to the checklist before we go to the next slide. So with the order, I mean, with my plan, I always used to have, and you'll forget this, and that's totally fine. You'll have your own system. 4 check boxes: notes, handoff, hospital course, and orders. And then for orders of next day, the orders that we have to put during the day, me and my co-interns would always try. If I'm presenting my patient, I'm getting the order. I'm presenting my patient, and I'm discussing my patient. He or she would start to put in orders in as we're discussing, and likewise, or vice versa. If he or she are discussing and presenting their patient, I would have my device, whether it's a computer, my phone, and so on and so forth, and start to put in orders in. Depends on the EHR that you have. For example, here, I mean, I have access to the EHR using my phone. So for me, this increased my efficiency a lot. So I always try to put in orders for myself, or more likely for my colleagues if they're presenting. So this way we can save time. And then senior residents are amazing, especially beginning of the year, because they know that you're not familiar to everything. Sometimes you just want to put an ultrasound order and you know what you're looking for, but you don't know how to get that order. You can ask them and they will help you with that. And most of the time, especially couple of months beginning of the year, they will be reviewing your orders just to make sure that you're putting the right orders and you're not missing anything. So just another layer of safety and another point of reassurance that we can tell you about.
Perfect. And then after this, when rounds start, and then you will go through the typical SOAP format by discussing the overnight events, any morning updates, and then discussing the vital signs, the labs and everything, and then your assessment and plan. Typically, I feel like the assessment and plan is your time to shine. And as medical students, we're always used to reporting information rather than actually formulating our own plan and management. So always have this kind of approach to the problem. If there's a problem or if there's a certain abnormal lab, try to train your mind into figuring out differentials. Why is this abnormal? And how could I fix it? Or how could I approach this problem? And while presenting, that's when you could discuss the problems more in detail. For instance, the patient is having hypervolemia. It could be because of kidneys, because of heart failure, because of blah. And my plan is to do this and that and that. So this will make you develop to become more of a physician rather than just a reporter.
Yeah, I agree with this. I think we can go to the next slide, and I think we're spinning through these slides. I know these things most likely, and not most likely, it's totally fine if you start to forget. And once you start, you will start to go through these things and you'll start to formulate your own system. It's just to say that it's very similar to what we learned about with the format of presentation, things that you need to think about, and things that you'll start to need to formulate as you go through your residency. So pre-rounding, you chart, review, you talk to the nurse, you see your patient quickly, and then day by day you'll become more efficient comes to that. Then with rounding, you're with the team, you're presenting assessment and plan. And then after rounds, this is, these are, to me, it's the golden hour where I try to finish as much as I can, especially before the noon conference. And it depends on the program. In our program, I think even at your program, Amani, 12 to 1 is the noon conference time. So my goal always each day to try to finish everything from these 3 tasks. Obviously, you'll finish the first 2 because otherwise you'll not go to the noon conference. But then the after rounds part before the noon conference, so then I can go get something to eat and really attend the noon conference. So after the rounds, it's your checklist. So these are the 4 boxes that I have. I try at least to finish 2 of them. So the notes, and most of the time try to update the hospital course or the handoff. And then after the rounds, I can go over my old patients if I need to make sure that they have morning orders if needed. Your afternoon period would depend really on the program. In our program, depends on the exact rotation. In internal medicine, you have admitting days and cleanup days. Cleanup days in the afternoon, it'll be just making sure that the patients are getting their tests done, updating them about that, and discharging whoever you can discharge, and so on and so forth. And admitting days afternoon, you'll be ready to get new patients. Discharges, most hospitals would really encourage you to do them before 12, which is very nice. Many times you will be able to know which patients are discharging the day before, so you can start to work on that if you have time. But again, everything related to pre-rounds, rounds, and after rounds, if you forget now, that's totally fine. But always, if you have just these 3 big headings in mind, once you start residency, you can ask your colleagues, senior residents, what are the expectations of this part? How can I make myself more efficient, and so on and so forth.
That's true. And then we quickly talked about this in terms of new admissions. It's very similar to the day-to-day kind of seeing patients and stuff. But here you could just approach any, if there's something that you're unaware of, try to use resources like UpToDate, AMBOSS, handbooks, whatever works for you, whatever source of information works for you, you can always refer to it. And of course, your senior is the best resource in my opinion. I'm not sure if Mohamad has any additions to this point. All right. And then we briefly talked about the pager system. It's completely okay to be completely clueless. I used to put speakerphone on every one of the pages I used to receive so that my senior listens with me and tells me how to answer. Tylenol was a hard question for me at the beginning, Mohamad. I used to worry about, what if they have a contraindication, and should this be given? Should something else be given? So I used to stress out about every kind of page I used to receive. But as time goes on, you will realize that questions get repeated, and you'll become more comfortable with answering those pages. Just make sure that you answer them in a timely manner and not to delay things throughout the day, because it's always good for you, again, to be reliable. Just put a time limit for yourself. I want to answer this page within 20 minutes. If something urgent, of course, I need to answer it earlier, but just be more timely with this. And of course, ask your senior.
Mm-hmm. And one thing to mention about this, pages or just carrying the service pager is something scary. And at least, I mean, it's scary, especially beginning of the year, because you're carrying your patients and your colleagues' patients. So sometimes you'll be receiving pages about other patients. 2 points. First one, it's totally fine. If it's not your patient, ask them, because that would be better probably for the sake of the patient. If you're being asked about a pain medication or a dose to skip, ask them, because they know the patient and they'll be the one who are putting the orders for them. If it's a very straightforward question, like, can you please put in a Tylenol order, speaking about Tylenol again, and you know that the patient doesn't have contraindication, you don't have to tell your colleagues, can you please put in Tylenol? Just go ahead and put it. If things make full sense to you, they're asking you about insulin and glucose is 70, skip insulin. If you know the answers and you're confident about them, do them. The other thing, and this is something probably I did it a little bit different than Amani, and just to show you that people do different things, and then still, inshallah, I mean, there's no one right way. For me, the pages, I used to be a little bit worried more about carrying the service pager. So during the first 2 months, I used to try to carry it as much as I can, just to try to normalize this thing to me. The pages, I did not want to open, I was not used to open the speaker whatsoever. I used to try to get the phones on my own, just try to see how confident and how comfortable am I with things that I need to do. And then if I don't know the answer, I would tell them, I'll call you back in a few minutes, and then I'll discuss. If I think that the one thing I was 100% sure about, I would tell them what they should be doing. And then I would tell my senior, they asked me about this and I told them this. Again, there is no one right or wrong way about it. But I was just the idea of having to carry the service pager the next day was something I didn't like. And now, alhamdulillah, I think I'm really more comfortable with, because I know if it's something I don't know, I'll call them back. If it's something I know, they have their answer ready. If it's something not for me and I can figure the answer for them, I'll try to figure it out. And if my colleague is taking care of the patient, I'll give them the phone. This way, now I'm really not that. I mean, the only thing, sometimes if I want to go to pray or for example, Friday prayer, I would just try to ask my senior if I can leave my page like a few minutes with them until I pray and come back. And most of the time, nobody ever told me, no, you can't. And then, so that's the only probably disadvantage of carrying the service pager on specific days if you need to go and you might not be able to get back to the page instantly, but that's probably it.
All right. And then, so to wrap up our talk is, in terms of the basic pearls that you need to come out with this talk with, is you need to know your patients well. That's all your expectations is. You're the person that you will have the most updated information about your patients. Always seek help when you need it, and be a great team player to everyone in the team. That includes your co-intern, your senior, and everyone in the team. Like Mohamad mentioned earlier, if you felt like your co-intern is struggling, always ask and see whether they need any help, offer that, make your senior look good. If your senior is giving you a lot of education, if they're helping you out, mention it during rounds in a nice, subtle way. My senior taught me this, or my senior did this for me. So it's always nice to be kind to the nurses. If social workers are struggling with something, try to see if there's any way that you could make things better. So being a team player is really, really helpful.
Yeah, I think I have just a few quick points too. I was just looking at the points. So things also to keep in mind as you start your residency. bigger picture. So what are you interested in? If you know that you want to finish internal medicine and be a hospitalist, primary care physician, these are all great things, but there are things that you would need to really focus more on. If you're planning to do fellowship, then think about the set of skills you need to develop. If you're interested probably in maybe ICU, cardiology, then are procedures something of interest for you? So if you want to do more injections, line placements, intubations, because this would be the time where you'll start to seek and look for opportunities. Likewise, if you're planning to apply for a fellowship, is research something that you like? Is it something that you don't like, but you have to be productive in for fellowship applications? Do you like to be involved in medical education? The key point is there's not a single perfect program. Most programs have their own advantages and disadvantages, and probably advantages more than disadvantages, but literally there's no program with perfect lifestyle, procedures, research, medical education, clinical training, good food, good city. There's none. So just be realistic. Always try to look at the full part of the cup. Always try to make good use of the things that you like and things that your program is offering to be a better person, better physician, and so on and so forth. You don't have to, and probably that would be an advice, not only you don't have to, don't start research as soon as you get in, just because the first 1 or 2 weeks can be stressful. But if you know that you like research or you want to be productive, just start to ask people, when did you start doing research? What's the outcome of as in abstracts, publications? Try to learn more about representation, how many times you can go to present. Will you be given days off? Are you going to be funded? These are important questions just because these would help you to gauge in and understand whether you would need to be more in scholar activity and whether it's something you like. Likewise, medical education, some programs have more focus on that than others. Is it something that you like? How much time and effort do you want to invest in? All of these are important questions that you don't have to answer now, but just start thinking about them would give you a lot of benefits, so you don't feel half of first year or the end of first year that you've done nothing and you had the time. If you've done nothing, but I mean nothing quote unquote, just going through residency is a big thing. So no one go through residency and they've done nothing. But if you have a lot of time and you like research and you had opportunity and it's approaching the end of first year and you've done nothing of research or and research in specific, then this is something that might start to make you upset as you finish your first year. But probably first few weeks, don't be harsh on yourself. Don't try to enroll yourself in tasks that you cannot finish, just because this will keep making you more stressful. And in residency, you don't have a lot of time. But just be realistic, do things that you like, and just look at the broader picture on what would be your goals, short term and long term.
And I think we went through over all of these points. Yeah, and if up to me, the entire summary would be stay humble, know that the fact that you're here is to actually help people out, be a decent human being, and ask questions when you want, take time off, feel relaxed, and take it one step at a time.
Yes, just be a good human being, inshallah, things will fall into place. It's not easy, but inshallah, it'll be enjoyable. Always reach out to, if you have any questions, whether to your residency, to your family, to your friends, to us, anyone who you think will be able to help you, just always try to reach out to them. And again, it's not going to be very easy, but when you are chosen to match in a specific residency program, you've done what it takes. So everyone is happy to have you, even if you started telling yourself otherwise, because that's not the truth of what you're telling yourself, or if you happen to be really harsh on yourself. I think that's probably it. We talked a lot, so now it's your turn. If you have any questions, whether you want to unmute and talk, or if you have any question that you want to send on the chat, if you want to address the question to a specific me or Amani, and we can just read the question and then send what we think is the answer is, or if you want to share it with the host so they can read it out.
And you can always reach out to us on our private emails throughout residency. Even if you felt like you're lost or had any certain questions, we're always here to help. And I'll write my email in the chat for you to guys reach me out if you needed any help. Well, thank you very much for having us. And I hope this was helpful.
Well, thank you, doctors, for the lovely presentation. It was indeed such a pleasure listening to all your beautiful advice. It wasn't just beneficial for the incoming residents who are the target audience, but it was also very beneficial for all the students and aspiring physicians. All of your advice was very heartwarming, and it was very grateful to you for taking time out of your busy schedules to help our fellow colleagues and aspiring physicians. To everyone in the audience, thank you for joining us today, and our team hopes that you found this session as valuable as we did. If you have any more questions, please feel free to put them in the chat now, or you can unmute and ask your questions. I'd like also to thank MBOS for their constant support. Also, make sure to follow us on Instagram and Twitter, and subscribe to our YouTube channel to receive the latest updates about all of our upcoming events. Thank you again, Dr. Amani and Dr. Alabdaljabar, and everyone in the audience once again. And we hope to see you all again in our upcoming webinars. Have a wonderful day.
Thank you.
Thank you, guys.